Hello, my name's Jamie
And I'm Heather.
and we're physiotherapists at Response Physio. In today's video workshop, we're going to be talking about sciatica. We're going to list through the causes, the symptoms, and give you a few top tips to help manage your pain.
Sciatica is basically pain down the back of your leg. Our sciatic nerve runs from our lower back and then it branches out down the back of our leg and it innervates the muscles and helps us feel things in the leg. Sometimes we get just pain, but sometimes we might get other symptoms like pins and needles or numbness or some weakness there.
So if you have any of the following symptoms with sciatica, it's best to get it checked out by a medical professional. That will include any numbness around your groin or saddle area, any issues around your bladder or bowel, for example, not being able to control this, or any symptoms that are coming down both of your legs.
Sciatica is a symptom, so it could be coming from many different causes. The most common cause is a disc herniation. So this is when some of the disc tissue moves slightly and impinges on the nerve. It could also be coming from a condition called stenosis, when we get a crowding of the spinal canal from degenerative changes. That's when the joints are more involved. We could get some impingement around the hip area if our hip muscles are a bit tight, specifically around the piriformis or a deep gluteal type of syndrome. That could cause irritation. Or sometimes if we've got a bit of a hamstring injury right at the top, that inflammation can irritate the sciatic nerve and cause the same symptoms.
Here are a few top tips to help manage your symptoms.
The first thing we consider is time. So for most people, pain and symptoms will resolve in about 6 to 12 weeks. Tip number 1 would be pain relief. So if your pain's stopping you doing anything through the day, so your work, your daily activities, and if you're not sleeping well, then we look at over-the-counter pain reliefs like paracetamol and ibuprofen if you can take them.
Top tip number 2 is to increase your activity levels. So whether that be walking, swimming, or just generally moving more frequently, we'd really recommend this rather than bed rest. As if you're lying in bed, this can make everything stiffer, all your muscles a little bit weaker, and in turn give you more pain. So that increased movement will help to get everything moving again and help with the healing process.
Here are some exercises you can do early days. So if your pain is really irritable and you're struggling to move, you can use these exercises to mobilise around your lower back and your legs that shouldn't flare your pain up too much. The exercises we've given you today are really quite generic, so if you're still struggling after trying these, then you can book an appointment with one of our physios to do a further assessment and give you a more tailored treatment plan.
If you found this video beneficial, please like and subscribe to our YouTube channel, where we go over monthly topics
And top tips to help your pain.
Thank you. Bye for now.
Bye.